Welcome back to This Was Supposed to Be Easy, your go-to podcast for connection, joy, and a good dose of laughter.
Hosted by two friends who've seen enough of life to know that it's never as simple as it sounds
or looks.
Each conversation celebrates the diverse journeys we travel, the moments of bravery, the strength we didn't know we had, and the joy we find along the way.
Because let's be honest, life is full of things that were supposed to be easy, but turned out to be harder.
And definitely funnier
than we thought. This is Amy.
And this is Cheryl. And if it were easy, we wouldn't be here.
Hi, everyone. We are back this week, and I am super excited that we have another guest, and that is Dr. Allison Arnekrans. And she is going to let us know a little bit about her, and then we will kind of jump into our topic right from there. So let's get started. Hi, Dr. Allison. Thank you so much for being here.
Thank you for having me. I'm so excited.
So tell us a little bit about yourself.
So I am a professor of counselor education at Central Michigan University. This is my 12th academic year that we're just finishing, which is really hard to believe. Part of my role is that I train counselors how to be a counselor. So that's clinical mental health, addiction counselors, and school counselors. In complement to that, though, I'm also a private practice owner and clinician. So I still keep my foot in the door. I think that's the best way, is to both educate on the craft, but also do the craft, right? So you know what you're talking about and have some examples to provide. So I have been doing that since 2009 to be a counselor. My clinical interests, though, have really changed over the years. So I started off as a child and adolescent therapist working in community mental health setting, and then now just do telehealth from my home office, virtual only. I don't have an in-person office, but seeing women's issues, seeing high achieving professionals, just general, couples and communication issues, perimenopause considerations. So a lot of just, as I've grown or, changed in my life, my clinical interests and experiences have changed a little bit as well. So again, both educator and clinician. Those are the two perspectives that I'm coming from today.
So I know we kind of asked you to be on this show today to talk a little bit about counseling, mental health, therapy, all of those types of things. And obviously you have so many different interests that are out there. What are some of the things that when you think about therapy and your interests, what kind of led you to wanting to talk about all of these things or even be a therapist? Where did that kind of come from for you?
I have one distinct memory. My great aunt was in hospice on her deathbed, and my one sister she was studying to be a nurse at that time. And my mom said it very clearly. She said, "Gosh, I can really tell what disciplines you both are going to go in." My sister was fluffing pillows and, rubbing her feet and asking her all these questions. And I just sat next to her and held her hand and said, "How are you feeling? Like, what is going on in your head?" And so I think I've always kind of had that innate skill set of just, caring, an empath, thoughtful, trying to really hear other people's perspective and, listen attentively. I think some of those have just, always been skills that I possessed. And so it just really lent well to counseling. But I mean, definitely some internships, jobs along the way have just, shared or highlighted what are your strengths? What are some areas of growth? What do you do not like? For me, that's like finance and business or fundraising, asking for money, things like that. But again, just helping people knowing that, there's always, everybody can benefit from counseling, and I definitely came from a family that it wasn't common that people were like, we just keep that in the family. We're not counseling people growing up. And so it was a little bit of a risk maybe to me and for my family just to say, I'm going to step out here a little bit and not do nursing, which everybody encouraged me to do. Some of those career related messages that we hear growing up, going against the grain, that is kind of tough sometimes. I guess that kind of led me into my impetus for wanting to talk about this, just in terms of, I think therapy can be for everybody, whether you come, from a family that's super pro counseling or not. And I would say too, you can benefit from it in different ways at different points in your life, right? So like what I needed as, an adolescent is very different now than a middle-aged woman. So just, your needs may change as well.
As I was listening to you talk about your counseling, therapeutic issues shifting as your life changes, it just made me think about what we talk about as women and the different phases of our life and what finds its way into our conversations. I mean, Amy and I spent a lot of hours in the car together over the past weekend. And our conversations, very much hit on perimenopause and menopause and all of the things we're doing with our families and with work. And it's sort of beautiful that as a therapist, you're able in some ways to shift that focus as you yourself are living into new experiences. And it sort of makes me think about a phrase I think I've heard many times, which is, that a good therapist is really trying to work themselves out of a job. They're trying to help you move to a new point in time where, whatever is next for you might require a different person with a different expertise or skill set or interest area. And I guess I just say all of that because I'm thinking about, I don't know, sometimes people are very fearful of entering into a counseling situation. Like you said, you mentioned, growing up in a family that was maybe pro counseling versus not so much, like keep it inside, keep it quiet, or at least inside the family. It just makes me think about a lot of misconceptions that are very likely out there with therapy, and even people may be feeling like it's taboo to whether you go or don't go or engage with it, to say you do, that you go to therapy also could feel like that. And so I'm wondering what, from the other side, what are some of the misconceptions that you hear?
hmm That's a great question. First, I wanted to address one thing is that, I'm the recruiter for our program. So encouraging people to consider counseling as an option. And actually, I just gave a presentation in Dr. Angera's class yesterday.
Mhm.
And one of the first bullet points is counseling is a super versatile career. So this is like an aside. It's not a program promotion in any way, but just to say that, the skill set that a counselor obtains with intention through the program is something that they can take whether they stay in counseling or not. Right. So
Mhm.
me, I did want to be a nurse at one point. I can still go to the emergency room because I have crisis response skills or, crisis training with this skill set and degree. So I appreciate the versatility. Yeah. That I can change my interests, that I can change, the populations and settings that I work with. Yeah. Again, based on my life, based on need or responsiveness. There was a time during COVID that we were providing medical professionals like process groups during COVID of just like, again, responsiveness in terms of what's going on in our world and how can we be supportive. So it was a total shift from, my one or two telehealth sessions a week to be in a group setting, focused on trauma, on overwhelm during COVID, but there's flexibility in that. And so I do appreciate that, but I digress. So the myths, that is a huge one because there are quite a few of them and I don't want to be overwhelming. So I'll share just a few, but please know that there are certainly more. You kind of alluded to this already is, do I have to be in counseling forever and with the same person? People are like, is this like a life sentence or like, am I signing like a contract forever? And the answer is no, none of the above are true, right? So yes, you can absolutely, some people do go to counseling for life. They want that support. Maybe it's a few different providers across the lifespan, but having that external perspective is really valuable to them. And they see it as just like, brushing your teeth, right? Something I do every day. It's a habit that I receive my support in that way. Other people kind of use episodic counseling. Like I'm just coming for this specific thing at this time, a divorce, a death. I'm having really significant communication issues with my partner. I'm really overwhelmed in my job, right? So a variety of things, but they're just coming to kind of tackle a one and done situation. And that's appropriate too. So it doesn't have to be forever. Counseling doesn't have to be forever. And again, you're not signing this lifelong contract to say like, if I start counseling that I have to stick with it forever and or with this person that I may or may not actually get along with or like feel a good relationship or rapport with. So I would say that's one. Another one that I hear a lot is maybe therapy or counseling is only for people who are really struggling, like who are really in a bad place. Not the case.
Mhm.
Everybody can benefit from counseling in some way, in some shape or form. It's not relegated to just people, yeah, again, who are in crisis or who have a personality disorder or who've been, in an inpatient stay. Mm-mm. Yes, that exists. And there are certainly supports for that higher level need or care. But counselors every day see people who are just doing life, who, they don't necessarily need a reason to go other than, I want to continue to become well. I want to, establish good communication and boundary skills. And I want to process things. So it doesn't need to be anything more than what you want it to be. I think that's an important one too. All right. And I'll just do one more. Just the list is long. But another one I hear a lot is I should be able to figure this out on my own. I hear that one a lot of just like, whatever I'm going through, I should be able to get through it. And some of that's like, the messaging along the way that you've received. But the good news is you don't have to. You don't have to. So I think a counselor can be really beneficial in that way, to just be a safe space, to be, a listening ear, somebody non-judgmental who will listen without all the context of life, right? Like, so they're not in your world. They have this alternative perspective where they can ask, clarified questions, and they can offer a different perspective for you to consider. But at the end of the day, you are the driver of the bus. So it's not somebody telling you what to do, right? Like, here's your advice, or like, here's your prescription on what to do. Counseling is really meant to be, here are some options. What is reasonable and feasible for you? Like, what can you make work? What are you willing to incorporate or do differently? And I think people really find that flexibility and the collaborativeness, the collaboration of it all, they really find that to be beneficial in their own experience. Again, that it's not somebody telling you what to do, it's somebody walking the journey with you.
I really appreciate hearing, especially that final one, because I don't know, you get in that role. I'm an oldest child, and I'm highly achieving. I'm always working for the next thing. And it's so hard sometimes to let go of that sense that you have to be managing a lot of things, that you need to know everything, and you can't maybe shift something off. And I even was thinking about this course I'm designing right now, and how, I've been engaged in the process for, I think, 3 months now, and probably should have taken more advantage of the instructional designer that was assigned to support me, instead of doing it all myself. It's sort of a very comparable idea, I think, of, I have to do it all myself, versus I can have this person just to talk to as I go through things.
External processing, my gosh, the benefits. I mean, just think about, your car ride in the Girl Gab, right? Just the ability to say something out loud, to maybe they share it back to you, like in the form of a reflection or a summary, just to say, did I just hear that right? Or, and even sometimes when it rolls off our tongue, we're like, that's not what I meant. Or, is that really what I meant? Right. Like, right. So questioning yourself, or just, digging deeper. So the ability to externally process through talk therapy, it's a really, really important and beneficial thing that we're working to make it more accessible for everybody, but we know it's not, right? In terms of the financial considerations, time. And I would say, especially for women, is that we are ingrained to believe, right? We have to have it all together, and we have to appear, control, and manage. And again, goal achieving, goal oriented, as you say. Some are and some not. I would say the benefit of counseling in that way is just that there's a counselor for everybody in terms of their needs, right? So whether you're super high achieving, or whether you're just, struggling, getting by, there's a counselor that's a good fit out there for you. It might take, a few sessions to figure that out, of like what you need more or less of in terms of a counselor. There's a lot of flexibility and, I don't know, power in the relationship, that it can be really life-changing. Just the relationship in and of itself.
It's helpful to think about, because I am obviously a huge proponent for counseling, and will sing it from the rooftops. But I'm also thinking about the different kind of versions I've had of myself over the years. And I remember at one point being the person that everyone would come to, not as a counselor, but I was the friend with the listening ear. And so when I thought about going to counseling, it was almost like, well, I shouldn't need to go to counseling because I'm the one everybody always comes to. Can you talk a little bit about that too, for the person that, the person that might be listening, thinking like, I feel like I often wear the hat, though unofficially, of counseling. Why would I need to go to counseling too?
Ooh, that's a good one. My mind is spinning with options on where to go with this. One of the first thoughts that came into my mind is, but who's holding space for you? So, right? Like, yes, you have a listening ear. Yes, you're empathetic and you care deeply about others, and you want to be that open space, and you can be. But at some point, it's going to get heavy in your own world. And then who is checking in on you? Who's asking you those questions? So, just as we teach our counseling students, is that you can't, that real cliche, you can't pour from an empty cup, right? But just that kind of concept of you have to have a full tank in order to be able to provide quality care as a counselor. So that means doing your own work. So even our counselors in training are required to do their own counseling, to be able to understand, what does it feel to, be on the other side of that chair, and to understand how it feels to open up and, share the things that you're requesting of your clients.
If you're the person that everyone is usually coming to, what are the benefits? And I think you talked about that. The benefit is that who's holding space for you, and you can't do it all on your own. But I would even follow up with that in the form of a question. So then what happens with the misconception sometimes of feeling like, oh, well, I have friends. If I really needed somebody, I could just talk to a friend versus, do I really have to go to a mental health professional
Mhm.
versus, oh, I'm sure I could probably just talk to somebody if I ever really needed it.
Sure. I get that one a lot. And I would say this to you, that the perspective of the counselor is different, again, because of that contextual piece, is that they don't have the understanding of, I call them the cast of characters. So the people in your life, they don't have the understanding of the relationship. So it's something that you have to describe to them. Like, you have to put it out there to help them understand. So that unbiased, non-judgmental perspective is going to be a really supportive environment for you to, again, to reflect, to process, to brainstorm. I think that's something that we've likely tried to fix the issue on our own in some way at some point, right? So, but usually counseling is not the first step. It's not, like, okay, I'm taking this to counseling, or like, I needed a counselor because of this. It's usually like, I've tried to talk to somebody. I've tried, to make amends. I've cried it out. I have not one tear to hold in, right? So you've tried all these other options, and then you come to a counselor to say, I need some external perspective. I need to be able to process this in a different way, with a different person, because what I have done is not working. So I think that that's how typically people get there, is that they have tried talking to a friend. They have tried, a trusted adult, whatever. I'm thinking from the parental perspective. I've read the parenting books. I have, listened to the podcast. I've done all the things, and my parenting skills, they don't work for this situation or this. So even just in that case of, hearing a different perspective, learning from others. So I'm thinking about like group counseling, for example, to have the validation from other people to say, like, what you're going through, you're not alone. Sometimes that in and of itself is such a powerful way for somebody to recognize, I'm not alone. I do have supports. I can get through this. These people have all done it. I can do that too. So
Or of a group.
the group, yeah.
Yeah. Yeah. I'm thinking about someone who's made it to their early to mid 50s, say, and they haven't made that step to reach out to a counselor. And I think sometimes that makes it even harder, right? Because now it feels like a much bigger ask or decision to make. And I'm also thinking about, the person who's coming, and I've cried all the tears, I've done all the things. And I'm wondering if there's someone who's gone all this time making it by and holding tight. It feels like it would be so much harder to be in that moment of something being so overwhelming. And now also I'm going to like take this step. And I'm wondering if, if there are low pressure, easier points in time, like maybe I'm like, no, things are pretty good right now. Maybe now is a good time
Mm.
to see a counselor when it doesn't feel so overwhelming. I don't know. What is your reaction to that whole
Thing.
word? What do we call that word mess, word scramble?
I not scrambled at all. And actually, that's there's a meme that it's like somebody's brain, and above it is this cloud of like tangled yarn, and then the person is a counselor sitting across from them, and they're like, "This is therapy." And so all the yarn is untangled, and all the colors are separated, and so it's like clarity, right? I really appreciate that visual in counseling, because that's what our role is. It's to help you unravel some of that stuff, look at it from a new angle, and consider other options. But I want to say too, counseling's for any age and stage in life, right? So yes, as a person, you might feel overwhelmed being like, gosh, I have 50 plus years in life. Where would I even start? Right? Like, that kind of seems overwhelming in and of itself. Maybe you came for a specific reason that you wanted to address, but maybe it's just like, yeah, I just want to, understand some of the things that have happened to me. I would say I definitely see a difference with proactivity and then the reactivity, right? Am I coming as, again, a part of my wellness routine, to gain clarity in a certain way, to work through something? Or is this kind of I just had a crisis and I need some help now, right? So I think there is a big differentiator there. Both are welcome. Both options are welcome from a counselor standpoint. We want to help you wherever you're at in that journey. And a counselor does a really good job to help you clarify that. So whether that be through goal setting, just the general question, where do you want to start today? Right. So helping you kind of narrow in a little bit of what is the thing that's, most impactful or, pressing on you at this point. And let's start there. Right. So they help you and they guide you in that way so that it doesn't feel so overwhelming in terms of where do I start? Or like, how do I do this? There is structure to counseling. There is structure, but at the end of the day, it's still a conversation. So it's not, I would say that's another one myth that I would say counseling's not like maybe what you see in the TV or the movies where, there's like somebody sitting in a chair with taking their glasses down and being like, and taking notes, right? Like that, not typical. It is a conversation. It feels very natural. There's structure and intentionality behind it all, but it's your session at the end of the day. So you say what you want to talk about, what you're not ready to talk about. Those are all considerations.
So with the structure, what would someone expect if they've never been to counseling and it's their very first visit?
Perfect question. You make a call or an email, you get in the door, you get an appointment scheduled. That first session does feel a little strange because it's really just information gathering. The purpose of that one is not to fix or, for maybe you to like share your entire, your deepest, darkest secret. It's more of information gathering from kind of all of the perspectives in your life. So counseling is really holistic. We look at all, the angles, your education, your relationships, your background, work experience, substance use, history, all the things. So that first session, you'll just be sharing whether it's again about a specific issue or the entire your lifespan of some important things that have happened. That first session's just a good one to say, do I vibe with this person? I'm looking at space, right? Like their presentation, like all those first impressions, right? As a client, so like for you to make some decisions of, is this a good fit? Like, should I stay? One important thing that I note or encourage people to consider is that there are like 10 to 15 minute free consultations that most counselors offer just for the client to ask some questions about the process and maybe their like theoretical orientation or like what's counseling going to look like under you. Free, no commitment. You can say, I'm good. And they can say that as well, right? Like I don't, as a counselor, I'm not sure if I can be, a good fit for this based on whatever the presenting issue is, or maybe it's a logistical consideration like scheduling that they can't be supportive. So it's a good two-way opportunity to say should I consider this? Like, would this be a good fit? Should I commit to this or not? So you can always think about that as well. Information gathering for that first session, the questions, there's a lot of them. They sometimes feel disconnected, but at the same time, it's really just helping your clinician to say, how am I going to put all the pieces together and understand where we need to go next to do the work? So subsequent sessions then would be, a little bit more tailored to what are your specific goals? How are we going to meet those goals? And as you talked about in the beginning, working me out of a job. So how do we get you out of here? Like, what is the end goal here? And maybe that is, again, that this situation is resolved. Maybe it's, I just need to have this, person in my life that I know that I can trust. They have this space for me and I can go as needed. So it looks different based on each person and what they need.
One of the things that I remember hearing a lot when I would talk to people who were going into therapy was that I don't know if I need therapy. I want to go with my partner, but my partner won't go, and my partner's the one that needs therapy. What would you say to somebody who maybe is in that situation where if the other person would only do X, our life would be fine? So if they won't go, then why should I go on my own?
Love that. And very familiar circumstance with that one. What I would say to them is we know that we can't change another person's behavior or approach, right? But we can do something different on our end in terms of our response, our reaction, how we approach the situation. So let's maybe consider counseling to focus on maybe different ways that you can communicate, or how can we establish maybe a different vibe or approach within our home or within, again, this circumstance. And what if you weren't so angry about this situation and you had a place where you could vent, where you could process, and you got some of that out? So maybe your approach in the situation might be very different as a result. So what could you do a little bit different? I think, and we can all do a little bit different. We can adjust things, and even just the smallest adjustment can make a huge difference in the way that that person receives communication understands, the dynamics in the relationship. So I would just say there's work that you can do as well that might change things separate from that other person. And maybe that change might inspire them to consider, counseling or some other approach as a result of, watching your success or watching things, be done differently within your realm.
Now, on the flip side of that, sometimes I know when people change and they grow and they're in a relationship with someone else who's not growing, that can also feel really uncomfortable. What would you say for somebody who's in that uncomfortable space of growth
Mhm.
when it seems like those around them aren't?
Sure. That's an important one too. So my approach for that one would probably be, let's do some empowerment of, let's notice what growth that you have experienced and, how you're making progress. And then having that, maybe it's a little bit of a difficult conversation to say, what is it that you're wanting next? So like, is this, I want to stay and repair or, work on this? Is it, might be considering, a change in terms of like, are we going to stay together? Is growing together an option? Right. So, and again, not prescriptive in terms of, I'm not going to tell you what to do. We're going to provide a variety of different scenarios so that you can kind of think through the benefits and barriers of all those and come to a decision that feels the best for you. Maybe it's a decision that's made, with an end goal or an end time, or maybe it's just, thanks for all that information. I'll sit and think on it and maybe I'll make a decision in the future. But there's not going to be like somebody pushing you to be like, have you left him yet? Right. Or whatever it is, it doesn't have to be a specific person. But so I would say, it's not that pressureful. You have to make a decision or, I'm not going to see you anymore. So I like to dispel that myth too, is that it's just a process and it's a conversation and you will do with it what you want.
I really appreciated the way you asked that, Amy, and the way you talked about it, Allison, because I was just thinking about so many other kinds of life situations that don't necessarily make you think immediately, I'm making a decision between staying or leaving, right? I remember way back, I don't know how many years ago now, 20, I had lap band surgery, right, to lose weight. And you had to go through several group sessions ahead of that surgery because they wanted to make sure that you were aware that there could be reactions from people in your life that weren't as happy and thrilled and supportive as you would expect them to be because maybe you've lost weight. They might be upset that you're not wanting to go out to eat or eating the same things together or, whatever it is. So I was thinking about that as you were talking. I was thinking about, I don't know, like decisions individuals make to, like, I earned a certificate in applied positive psychology. Well, that whole learning process definitely influenced how I approach things, my mindset. And that could have been a space or a place where, had I not been having conversations with my husband over the course of the process, that we could have deviated pathways, or different ideas, or even, big things that happen in the world, like the pandemic and differences of opinion and how things were being treated. There are just all of these events in life or choices that you don't necessarily see potentially impacting a close family relationship that really, if you might not be growing together or thinking about what that growth could look like in terms of relationships. I don't know, there were many, I don't know, touch points to think about as both of you were talking and answering.
And I mean, certainly that's an option, right? So counselors can see you as an individual, and then maybe you have another counselor that's for you as a couple. So different relationships, different perspectives, but that you feel this is for us in the relationship. This is for me and my, my personal self and well-being. So there are options and opportunities for that. I certainly, though, I want to validate the experience of what if that person doesn't want to come or engage, or, they have their own thoughts or background with counseling, maybe that weren't so positive.
Mm-hmm.
How do I navigate that? So I often just say, leave the invitation on the table, right? Of just, you can ask, you can share, how you benefited, you can encourage, but you can't force. So I'm leaving it as an open-ended thing of, you're always welcome to join me and I'd be so happy to have you. But I know that this is something, that you would need to want. Like it's just, you would need to invest in. And not everybody's ready for that at that moment in time. But again, open invitation, meaning that it might not be today, but maybe at some point.
One of the things that I'm wondering about, and I'm actually just starting to hear about it, and so I'm wondering if maybe you could expand on it. And it's that, we often hear if two people are going to therapy, it's usually because they're a couple.
Mhm.
But what about recently I heard about like family that were, so it was, I think, a mother-daughter relationship. And I've heard another one of like siblings and things like that. What would you say about that adult family going to therapy, or even if you have, good friends that maybe
Mhm.
are at like a point in their life where they don't want to let the friendship go, but they need beyond the conversation that they're having on their own. Like, what
Mhm.
about some of those relationships that maybe have not been traditionally brought to therapy before?
Love it. Love it and welcome it and encourage it. I think that is awesome. There was a time when people were like doing the premarital counseling and they're like, we're already in counseling and we're not even married. Like, how does that work? Like, that doesn't feel good. And I'm like, please do that. Like, have these conversations now, talk through things, identify weak points or, the tension filled moments. Talk about that in advance. And absolutely, gosh, I can't tell you how many situations or, clients I've had over the years who maybe they have had a specific relationship, whether it be sibling, oftentimes it's parent, that really changed the trajectory of their life in many ways, and they don't even know how to go there and make a change or understand things from a different lens, and again how impacted they have been by this one really important relationship in their life. And I imagine one client specifically, gosh, if she could sit down with her mother and with a mediator as a counselor, so have like a mediated conversation, I can't believe how many things would be different in her life if she could just share some of her thoughts and feelings with her mother and work through some of them, right? Again, brainstorm. How can and even just to hear, I'm sorry, right? Something like 2 words, how that would change the entire dynamic and in the content of what she brings to session, it would be drastically different. So I would say, welcome again, please do that. That is an awesome way to be, again, proactive and to say this relationship is really important to me. I really do care very deeply about you. Their miscommunication or context, like something is not, we're not being able to work through it. So we're going to invite this third party in to say, to hear both perspectives, to moderate the conversation a little bit so that everybody does feel seen and heard and valued and respected. And then we can hopefully make some progress with that. I'm really glad that you brought that up because you're right. I would say it's not as common. There's a little bit more stigma around it, but I'm hoping to see some more change in that way, is that it's just anybody can talk about what they need and want with whomever that they want, not just it's you're the issue. Let's focus on you. It doesn't have to be that way.
I heard you mention quite a while ago your practice, including maybe exclusively, I can't remember now, telehealth.
Mhm.
And I suspect that that was a big shift through the pandemic, but I could be wrong. I also feel like it might open the door to people who might have not wanted to walk into an office. Have you noticed differences with
Mhm.
the onset of more telehealth options?
I have. Some people are adamantly against it, right? Of like they want, again, to be in a different space, feel context to work on some of their issues. And so they prefer in person only. And I totally respect that. Mine was more just about timeliness of, right.
Mhm.
And that I have this other full time job that is rather demanding. And so I just, yeah, it didn't make sense financially to open up a physical space. In my discussions with a lot of other counselors, though, they've been talking about this very thing, is who is attracted to telehealth? Why is it, what makes it a good option for some? And you're absolutely right. Definitely post pandemic, there's been a huge increase in people taking advantage of the telehealth. There was definitely a period, maybe in like 22, 23, where people were like, I am so sick of being on a screen.
Mhm.
I can't do telehealth. But I think it's reemerging for people like high achieving professionals who are like, I have 45 minutes on my lunch break. That's what I can give you. And I certainly can't get to the office to make that happen.
Mhm.
Stay at home moms are just, yeah, working moms who the kids, maybe they have young kids, they're at home, they're in the background, they're safe, but this is what I can give. I don't have a sitter, this is what I can do. People, yeah, who maybe are unemployed at that time, right? I'd be like, I have all the free time in the world. How, like, but maybe, yeah, transportation is an issue.
Mhm.
Maybe health. I am so depressed, I can't get out of bed right now. I would
Mhm.
really benefit from some, talking to somebody, but I just can't get there. So yeah, the scenario list goes on and on who can benefit from it. I have seen definitely some people just like, I really need the in-person, like that matters more to me. And then I have people who are like, telehealth is the only option. Like if I'm going to seek therapy, this is the only way I can do it. I don't know if that answers it.
Yeah, yeah.
One of the other things that I'm kind of thinking about, so as you know, the theme of this show
Mm.
is I thought this was supposed to be easy. So in that lens, what are some of the conversations that you've had, no details, but that people seem to think there was the misconception that something was going to be easy and they were surprised when it wasn't?
Mm,
And maybe that's even something that you've discovered for yourself along the way.
yeah. In terms of this, I would say I thought finding a counselor was supposed to be easy, right? I have had several clients who are like, I just can't find the fit. I struggled with the connection. I don't know if you know this. There's even like, like Match or like OkCupid, some of the dating sites. There's actually like dating sites for counselors now where you can swipe left and swipe right. So you put all your information in saying, here's what I'm looking for in a counselor. And then and I actually had one client contact me based on the results that I was a good fit for her. And it was the most productive relationship I could have imagined. It was
Wow.
so powerful. It was so awesome. And it felt intentional on her part too. Like she did her homework.
Mm-hmm.
So yeah, she swiped right and it was productive. But that's not always the case, right? And so again, taking advantage of that free consultation piece, asking for, referrals from people is, word of mouth is always a powerful thing. So being okay, I would say that it's okay to try things on. It's okay to say, this is working for me, this is not. From that counselor perspective, we have the same experience, right? Of like, am I competent to work with this person, on this specific issue? Does it feel like there is a connection that, they're open and willing and wanting to do this? So we say no, just like clients can say no of like, this isn't a good fit. So I would start there. And maybe they had a bad experience with the counselor, which is not unheard of, right? Of like, they didn't like their approach or, something was off. I have some clients who come in, they're like, I'm so sick of retelling my story. And I certainly can relate to that, right? Like of starting over, that's overwhelming at times. Like I have one who she's had a long-term counselor and she just moved to this area. And so starting fresh and she's like, like I didn't come for a while because I was so overwhelmed about having to like retell everything and start over. So just reframing that as let's start now. Let's start here where we're at this point. We don't have to, maybe some of those gaps will be filled in along the way, but trying to reduce that overwhelm just to say, you don't have to rehash it. We can just start where you want right now.
Mm-hmm.
What about for those that feel like they love therapy, but it's a financial obligation or, it becomes a financial thing?
Amy, we're seeing that more and more with the changing climate with inflation lately, all the changes in deductibles and plans. And it's a barrier to access right now. That's a huge thing. So there are some options. The one that comes to mind right away is college students. You have a counseling center embedded into your college counseling center. And that's a free option. They don't have to diagnose. You don't have to pay anything. They're just free services provided for students. So that's an easy option. Our counseling program, though, actually runs a free mental health clinic out of our university, separate from college students. So it would be college students can attend, but this one's actually for the entire state of Michigan, again, via telehealth. So we can reach anybody maybe who, they lost their insurance or they don't want any type of record keeping, on paper. They just want something. This sometimes happens with like military or law enforcement that they're like, I want to talk about this, but it can't be something that's, on like a permanent record. So there are some opportunities for free services. Seeing an intern is also an option. So, right, like we have practicum and internship students who that's what they need is they need time with clients, real people, real issues, so that they can become a licensed professional counselor. Oftentimes their services are free and or a super reduced cost, maybe $10, $15, $20. Certainly we recognize then though that an intern often leaves, right, to go pursue the other things. So probably depends on what you want to work on. This like one issue that you can maybe solve within the duration of a semester, or is this more like a long-term consideration? So there are some opportunities. Another one would be a sliding scale, that if you tell your counselor, hey, like I was able to use insurance for this amount of time, things have changed, I can no longer, but I don't want this relationship to end. Counselors are required to do some pro bono work every year. It's in our ethical code, actually, that we must be responsive in that way. But also then, how can I work with you? How can we make this work for you? Whether it's a reduced session fee, whether it's maybe we're, putting more time between our sessions, maybe it's 2 or 3 weeks as opposed to weekly. But just having a really honest conversation about how can we make this work. Most counselors are pretty amenable to that. They want to be supportive and helpful in that way.
I really appreciate hearing the different access points that break down some of those barriers and make the opportunities available to more people. And again, maybe even make the opportunity available to those who are hesitant.
Mm.
I think for me, the final thing I'm curious about is, I mean, I've heard lots of ideas, I've heard tips, I've heard entry points. Is there one thing that you would hope a hesitant, one of our listeners, a hesitant listener, might take away from this episode?
Mm. Is it going to hurt you to try it?
Mm.
That would be one question I would pose, is just try it out, see, use that curiosity. I have some people who definitely do their research, right? Like they put in keywords or terms that are specific to their unique circumstance, that they're looking for a provider that has, a specific expertise, or just by being who they are, the color of their skin or their age, or again, stage in life that can really resonate with somebody. So a counselor is pretty intentional to write up their bio to say, here's what I can specialize in, here's what I know, or I have extra training or experience in. So I would say do some research, but again, there's going to be no consequence to you trying it out. And I really do believe that most people walk out of there and they're like, okay, that wasn't that bad. Like that was okay. I can do this again. I had one person who had just finished her counseling appointment recently. It wasn't with me. And she's like, I am legit. Like you could see the high. She's like, I am on top of the world right now. Like I have so much energy. Like I'm just to be heard, to be validated, to be supportive in a way that many others can't for you. That's your undivided attention. That's your hour to say and do whatever you need. And whether that's crying for the entire hour, whether that's word vomit for the entire hour, whether that's sitting in silence, they're all okay. And they're all welcome and they're all accepted. Whatever you're going through, that's where we start. And so that it's an open invitation. I would say consider it. I would say be curious about it. Like ask the questions that are maybe preventing you. Ask the counselor, like just be open and frank of, here's something that was preventing me from coming for all these years. Let's go there and talk about that. We can only, at the end of the day, counseling is a talk therapy that it's based on what the client shares. So if you can withhold or guard as much as you want, you can also be as open and exploratory as you want. But I just keep saying everybody can benefit in some way. We are all going through something. I would just finish with, everybody can benefit from counseling, and because we all are going through something. And again, maybe it's at one point in your life, maybe it's your whole life, right? Maybe there's some unresolved things. Maybe there's some things you aspire to, right? So like forward thinking, any of those are welcome, and just try it. Just try it. There's no consequence to it.
We thought life was supposed to be easy, but we thank you for giving us some tools to make it a little easier today.
Absolutely. Thank you so much for having me.
Yeah.
Thanks for tuning in to This Was Supposed to Be Easy. Remember, the best stories are the ones we live.
Don't forget to like, subscribe, and keep the conversation going, because life may not be easy, but listening in should be.
Stay curious, stay connected, and keep wondering.